Joining us is obstetrician, gynecologist and fertility doctor trainee with healthcare group, Dr. Nwachukwu Juliet Ogonna, and Adekunle Dixon Odukoya, consultant, Chain Reactions, Nigeria. Thank you for joining us.
Thank you.
And thank you for joining us as well, Adekunle.
Thank you very much.
I'll start with you, Dr. Juliet. Okay. Quickly, the basics. Okay. What causes cervical cancer?
Okay. So, actually, in the country, most of us know that women go through a lot of diseases, and cancer is one of the cervical cancer is one of the leading cause of mortality in reproductive women. Now, going into the cause of cervical cancer, one has to know what cervix is all about, because people just hear cervical cancer, but they don't know actually what the cervix is like. So cervix is the entrance to the womb of the woman, right? So, and the basic cause of cervical cancer is what we call the HPV. That's the human papilloma virus, yes. It has many types, and there are many strains of them that can cause the cancer. So, but other things that can actually see it as a risk factors that also lead to cancer could be things like smoking, if a woman is having multiple sexual partners, and also people that have weak immune system, and also those that also have some other form of genetic diseases can also have this increased risk of having cervical cancer. But basically, what causes cervical cancer is the human papilloma virus.
How does the woman contract the human papilloma virus? Or is it in the system? How does it happen?
Okay, human papilloma virus is contracted through sexual intercourse of any type. It mustn't be through of any type, because it could be contracted through skin-to-skin contact. Okay, so if a woman is exposed to sexual intercourse early enough, the woman is exposed
too early.
Yes, too early, yes.
Oh wow.
So too early, and the person is also already could be exposed to human papilloma virus and could get cervical cancer in future.
All right.
Yeah. Well, an estimated 570,000 women were diagnosed in 2018 of cervical cancer. Now, as men, what do we do to help our women in this regard?
All right, thank you very much. What we believe that everybody needs to do going forward is not to make it a women issue anymore, because we believe what affects the women in our lives affects every one of us. And we all have mothers, sisters, daughters who are as much as at risk of this disease. So what we have taken upon ourselves is actually to lead the campaign for awareness by ourselves. So we men have chosen that before the end of this month, since January is the Cervical Cancer Awareness Month, that we should take charge. Let the women in our lives understand more, know the facts, understand the risks, understand how they can prevent themselves, understand the fact that for young daughters and girls that are not yet sexually exposed, active, the vaccination goes a long way in ensuring they are about 99% protected from
At what
contacting.
point should the girls who are not sexually active take this vaccination?
I believe it should be before the age of 14 or 15. The doctor can confirm that.
Okay, at what age? Okay,
so human papilloma virus vaccine should be given early enough before the first sexual contact of the child. So, basically, say from 13 years and above, a girl child should get vaccinated. So you don't have to wait until the child is exposed before she gets the vaccine. So children from 18 years, actually the girl child from 13 years and above to about 26 years could get the vaccine.
So after that age, what happens?
After that age, actually the protection from the vaccine is not actually it's not beneficial, because
really?
yes, unless the person haven't had any sexual contact, then the woman can get the vaccine. But initially it was said that from 9 years and above could get it, but ideally from 13 years and above. But if you have a child that is 9 years, the 9 years can also get it.
All right. It is said that over 50 million Nigerian women are at risk of cervical cancer. Why is that? I'll start with you, Dr. Juliet.
Cervical cancer, as we all know, is cancer of the cervix. Okay, the cervix is the entrance of the womb.
Absolutely.
And a lot of women under reproductive age are exposed to the cause of this cancer, which is usually the human papilloma virus. And as far as they are exposed, this virus predisposes them to having the cervical cancer. And because of the nature of the cells in the cervix, this virus transforms those cells and make them to grow abnormally and lead to this cancer.
So that is why we're having such a huge number, 50 million, you know, having to be at risk of this? Or is this just peculiar to Nigeria?
All over the world, cervical cancer is a concern in women of reproductive age. It's all over the world. This concern is actually everywhere. And the huge impact of this cancer in our environment is because people are not aware. The awareness is very low. And that is why you have a lot of women being exposed and at risk of this cancer in our world, in our part of the world.
Okay. All right, so I will move to you, Lukoya. Now, how do we ensure awareness goes all around? Because first of all, in Nigeria, I will say a lot of people will say they do not have time. So how do we push awareness? And of course, some might not know that they have to go for vaccination for some time. So how do we push awareness such that it cascades everywhere, even to the grassroots?
All right, thank you very much. The first thing we need to do is for those of us who are like decision makers, who are responsible for others, to take the lead. We want fathers, first and foremost, to get their young daughters vaccinated, because HPV exposure starts from the age of 13, 14, and it is women up to the age of 65 are at risk. That's why we have that 50 million. Yeah. It's actually 50.33 million Nigerian women as at 2018, according to statistics. And the problem that awareness is causing is that 95% of the times when this disease is diagnosed, it usually comes at the end stage. So the chances of being saved is almost out. So
is it because the symptoms is not really out there? That is why it gets to that stage before
the symptoms are actually out there, but a lot of women assume it's, you know, one of those things like bleeding during sexual intercourse, like irregular menstruation. And I believe the doctor will explain more of that. But they believe it's one of those things a woman goes through.
Talk to us about the symptoms, perhaps.
The symptoms of cervical cancer, most time it could be asymptomatic, all right? But with the early stages, when it's not yet diagnosed, the woman might not know she has it. But with time, the woman can start experiencing things like bleeding during intercourse or after intercourse, and also bleeding in between periods, and also in women that have gone through menopause, any bleeding after menopause is suspected to be from cervical cancer. And these are the things that, that even other disease conditions can also give women such symptoms. They actually overlook that, and they think that maybe this is just one of those things that could just come and go. But also, if a woman notices that she's having profuse vaginal discharge that is abnormal and very offensive, it could also be a sign of cervical cancer. And during the later stage of cervical cancer, it could give you other symptoms like constipations, having blood in the urine, but those ones are the advanced stage. Yes, but the early stage is mostly abnormal bleeding.
All right.
All right.
Let's looking at cervical cancer. You have an event coming up quite shortly. Tell us about it.
Okay, I would like to talk about that.
All right, thank you. So, like we mentioned earlier on, beyond campaigning, what we have done is actually to take prevention seriously. So our organization, in partnership with our organization, we have decided to offer some of our girls and women, 100 of them, free cervical screening that will take place in the month of February. Okay. So we have a landing page where people can go and nominate someone who is less privileged, someone they know that cannot naturally or normally afford to have that test. So the page is www.smearmywoman.com.
How would you determine those who cannot pay for it?
Okay. So after the nomination, we are going to now do some background check by ourselves. So then we will whittle down to that 100 that we're looking for. So some of the background check is to actually we'll go on the field and see to the locations of these nominees and see their status, because we believe that while the level of awareness is not that much, we need to also reach out to those who are naturally disadvantaged in terms of, all of us have some women in our lives. Maybe you have a maid who cannot afford because the test is expensive, or she's disenfranchised from access to information. So we are now going to say, okay, instead of just talking about cervical cancer is this, let's start by also ensuring that we give out that free screening, which will also help reduce. Our target actually is to achieve 100% cervical-free status in Nigeria in the not so distant future if we continue on this path.
Okay. Interesting. So one aspect is the fact that for prevention, regular checks is important as well as vaccination. When we talk about regular checks, how do you mean? How many times are we talking about here?
Okay, cervical cancer, though is a leading cause of death in reproductive women, is preventable and is treatable. And ways to prevent it is, one, to take the vaccine, and also to go for regular screening. And this screening, which is called the pap smear, usually done 3 years, in 3 years' time. Okay? So if you do a pap smear this year, that means you're due for another screening in 3 years. Then also, there is also age, there's an age bound to that. If you between 21 years to 30 years, you should get the regular screening every 3 years. And if you're between 30 to 65 years, you should get the regular screening for 3 years. Or there's another screening that is done when you take the pap smear. You could check for the human papilloma virus. If you did that with the pap smear, you could get screening every 5 years. So that's the duration of the screening.
Persons between the ages of perhaps 35 to 65 can also get the vaccination, or a kind of vaccination after the screening quickly?
No, you can get the vaccine from 35. It's recommended that the vaccine should be given between 9 years to 26 years.
All right, Dr. Onwachukwu Juliet Ogunna, thank you for speaking to us. Adekunle Dixon Odukoya, thank you as well.
Thanks for having us.
Thank you.